Hi, I'm Dr. Gilmer from the Mammoth Orthopedic Institute, and we're here today with Ariel Duvall from the Mammoth Sport Clinic to show you some basic tips and tricks for use of your postoperative knee brace. Generally, your knee brace will be used in one of three ways postoperatively, and it depends on what type of surgery you had as to how your brace will be used. After all surgeries, the brace is generally locked in full extension. This makes it the most easiest and comfortable for moving your leg after surgery. For ACL and ligament types of surgeries, the brace will often be able to be unlocked 0 to 90 degrees to start early postoperative motion, but prevent hyperflexion, which could injure a graft. The second most common way is that the knee may bend 0 to 90 degrees, but is locked straight anytime you're ambulating or weight bearing, and this is often the case after meniscal repair or meniscal surgery. Finally, sometimes the brace will be locked in full extension for a full 2 weeks before starting any motion, and this is most often the case with certain procedures involving the patellar tendon, the patella, or the quadriceps tendon.
So next I'm going to demonstrate how to lock and unlock your knee brace. So the lock feature is up here. What you would do is you're going to push in this little black button and we're going to slide up to unlock the brace and then slide down to lock the brace. So you want to make sure that when you put the brace on, the lock and unlock feature is always facing up towards you, so closest to your head.
Postoperatively, you'll have a large dressing on your leg from the thigh to the foot. This is generally removed after 4 days, and after that time we recommend covering any sutures with a bandage or dressing to prevent irritation against the brace. In general, it's not necessary to adjust the brace settings on the hinge portion of the brace, as these will already be set for you immediately after surgery. And finally, if continuous passive motion was prescribed, you may remove the brace for use of the CPM and then replace it after completing your CPM exercises.
So next we're going to demonstrate how to put your brace on. So the number one complaint that I hear is that the brace tends to slide down when you stand up. So when you put the brace on, you want to put it up really high on your leg, kind of as high as you can comfortably get it, so that when you stand up, if it slides down a little bit, it's still going to be in the right place. So we're going to go ahead and keep this up nice and high. And then you want the hinges to be right at the middle of the knee joint here. So then I usually start with the strap on the top. And we're going to just make that nice and snug, because again, if it's too loose, it'll slip down. We don't want it to be painful, but we want it to be snug enough so that it's going to stay on. And then we're just going to take these Velcro straps and put those on as well. You will get really good at doing this yourself as well. But in the beginning, sometimes it's nice to have someone help you. So one other issue that I see sometimes with the fit is if the brace looks like it's a little bit too far back here. Again, that's something the therapist can help you adjust, but it simply just takes pulling these from the plastic and lifting them so that the brace, the plastic pieces here, are featured right on the sides of your leg. So just a couple more things to make putting on your brace a little bit easier. Sometimes, even if your brace is locked out, say the first couple weeks after your surgery, it can be a little bit easier to get you in the correct position if you actually have the brace unlocked before you put it on. So as we talked about earlier, this clip right here locks and unlocks the brace. If you have it unlocked first, then you straighten your leg all the way and then you lock it into a locked position. That tends to make the fit a little bit better. Another issue that I see is, as we talked about before, you typically don't need to adjust these portions yourself. However, sometimes they can get bumped and move easily. So just make sure that you ask your therapist or your doctor what position the brace should be in, and that you're periodically checking that that is in the correct position. All you do is push the black button down and slide up or down.
As always, if you have any questions, please refer to your post-operative handouts or our website, or call the clinic if you have any questions or concerns regarding your brace. Thanks for watching.